let me discuss few question and answer what is very important for NCLEX board exam. We have put together few most important topic and some tips for passing the NCLEX the first time. So it can works. Let's work together to help you to pass your licensing exam. The first question, a nurse is caring for a client whose cultural background is different from her own. Which action are appropriate? Select all that apply. Number one, consider the non-verbal clues such as eye contact or may have different meaning of different cultures. Respect the client cultural belief. Number three, ask the client if he has cultural or religious requirements that should be considered in his care. Number four, explain the nurse belief so that the client will understand the difference. And number five, understand that the whole culture experience pain in the same way. So select all category question. The correct answer is number one, consider non-verbal clues such as eye contact or may have different meaning in different culture. Some cultures say eye-to-eye contact is good, but some culture do not agree with it. They say eye-to-eye contact is a sign of rudeness. So number two, respect the client cultural belief. Whatever your patient believe, we have to respect. Number three, ask the client if he has cultural or religious requirements that should be considered in his care. Because if I believe in religion and if it gives me mental peace, nothing bad. So rational, non-verbal clue may have a different meaning in different cultures. In some culture, eye contact is a sign of disrespect. In another, eye contact show respect and attentiveness. The nurse should always respect the client's cultural belief and ask if he has cultural requirements. This may include food choice or restriction or the time for prayer. So we can give them time. They can do some meditation if they like. The nurse should attempt to understand the client culture, and it is not the client responsibilities to understand the nurse culture, but it is our responsibility to little bit understand the patient or client culture. If we don't understand, still we should respect it. The nurse should never impose her own belief on her clients. The cultural influence a client experience with the pain. For example, in some culture, pain may be openly expressed, whereas in other culture, it may be quietly endorsed. So they don't like to explode to the others. Next question. A client with colorectal carcinoma and is devastated after learning that the cancer has spread to the liver and lungs, and the client has only 5% chance to survive for next 5 years. Which comments by the nurse would the best help the client to cope with this news, right? So what is help to coping mechanism to adjust with this sadness? Number one, I have seen the client in your situation who have lived almost 20 years. Number two, it must be hard to hear that prognosis. And, and would it help you to take to me or the chaplain? Number three, this might be a good time to think about an average directives in case you run into the problem while you are here. Number four, those are just the number. You have to live each day fully and not worry about the time. So the correct answer is number two. It must be hard to hear that prognosis. Would it help you to talk, to meet, or go to the chaplain? So you give the scope, you give the opportunity, your patient will be verbalized. If they speak out, they feel good. So rational said, this response is the most therapeutic because it encouraging the client to express the feelings and concern. Option 1 and 4 means I have seen the client in your situation who lives almost 20 years. And option 4, those are just a number. You have to live each day fully. So this is the false reassurance, right? So false hope or reflect the nurse empirical observations, not statistics. Option 3, this might be a good time to think about an advanced directives in case you run into the problem while you are here. So number 3, inappropriate because an informed person who is not a member of the healthcare team should discuss and which level of the care the client wishes to receive in case of an emergencies. Next question, which providing care to a married client? The nurse note multiply or multiple ecchymotic area on her arms and tongue. The color of ecchymotic area range from blue to purple to yellow. So means different time it is happening. When asked by the nurse how she got this bluish or mark or ecchymosis spot, the client responds, oh, I trapped. How should the nurse respond? Select all the types. Number 1, document the client's statement and complete a body map. Include the size, color, shape, location, and type of injuries. Number 2, report suspicious of abuse to the local authorities. Number 3, assist the client in developing a safety plan for time of increased violence. Number 4, call the client husband to discuss the situation. Number 5, tell the client that she needs to leave the abusive situation as soon as possible. And number 6, provide the client with telephone number of the local shelters and safe hours. The correct answer is number 1, document the client statement and complete a body map including the size, shape, location, and type of injuries. You see, this is achievement, right? And number 3, assist the client to developing safety plan for the times to increase the violence. And number 6, provide the client with a telephone number of the local shelter and safe houses. So 1, 3, and 6 is a correct answer. The rationale, the nurse should objectively document her assessment findings. A detailed description of physical findings of abuse in the medical record is essential if the legal action is pursued. All women suspected of being victim of abuse should be concealed on a safety plan which consists of recognizing the violence within the family or formulating a plan to exit quickly. The nurse should also provide the client with telephone numbers of the local shelter and safe houses. The nurse should not report this suspicion of abuse because the client is a competent adult who has the right to self-determination. Nurses do, however, have a duty to report the cases of actual or suspected abuse in the children or elderly client. Contracting the client husband without her consent violate confidentialities. The nurse should respect the clients in a non-threatening manner that is promote the trust. And next question, 6 months after undergoing a radical modified mastectomy to treat the breast cancer. So if your patient have a breast cancer and doctor decide to go for remove the breast tissue, we call mastectomy. There are 3 types of mastectomy. One of that is a radical modified mastectomy. So after mastectomy, the client is admitted for chemotherapy. When the nurse enters the client room, the client is sobbing and state that she's so sad, crying. I thought the chemotherapy would help, but now I feel worse. Which response by the nurse is the most therapeutic? Number 1, I will bring you a sedative to calm you down. I will sit here with you for a while. Would it help you to talk about it? So you gave the opportunity to verbalize their feelings. And patient will feel good. Number three, don't worry. I'm sure everything will be okay if you just give it time. Number four, you probably should have had surgery sooner so the tumor could have been cured earlier. So the correct answer, I will sit here with you. Would it help you to talk about it? So rationale, in this response, the nurse is engaged in active listening, a therapeutic communication technique that is promote interactions focus on the client feelings and concern. Addressing the client feelings and validate her as a person and helps establish trust. And sedating a client would delay the dealings with her feelings. Telling the client not to worry and suggesting that the client should have had surgery sooner are non-therapeutic response that would prevent the nurse from helping the client recognize and deal with her feelings. Next question. A elderly client fractured his hip as a result of a fall at home. So elderly patient falling is a common cause of injuries. Because of this extensive cardiac history, and we found chronic obstructive pulmonary disease, the surgery is not an option. The client tells the nurse he does not know how he is going to get better. Which response is the best for this patient? Number one, you are doing fine. Number two, what is your biggest concern right now? Number three, give it some time and you will be okay. Number four, you do not believe you are doing well. Next question, answer is, it is your biggest, what is your biggest concern right now? The rationale, open-ended questions allow a client to control what he wants to discuss and help a nurse determine care needs. So nurse asks the patient an open-ended question, and that open-ended question asks means your patient will be verbalize their feelings, right? And patient feel good. It is the therapeutic way of communication and telling the client that he is fine or that he just need more time does not encouraging him to verbalize his concern, right? And next question, a client with newly diagnosed breast cancer asks a nurse, why me? I have always been a good person. What have I done to deserve this? So patient thinking, I were the good whole of my life. Why I'm suffering because of the disease? It is a question came to the patient mind. Which response by the nurse would be most therapeutic? Number one, don't worry, you will probably live longer than I will. So number two, I'm sure a cure will be found soon. Number three, you seem upset. Let's talk about something happy. And number four, would you like to talk about this? So you ask the question so that patient can verbalize their feelings. The correct answer is number 4. Would you like to talk about this? Because number 1 is a false hope. Number 2 is a false hope. And number 3, you seems upset. Let's talk about the post something happy. Number 3 is little bit correct, not all, because you seems upset. It is negative comments. And also let's talk about something happy. So you do not demarcate it. I'm going to talk something happy right now, and I'm going to talk something setful right now. So just going to talk, express, and give them scope to verbalize their feelings. The rationale, listening, responding quickly, and providing support promote therapeutic communication. Offering to talk about the client's feelings and validate those feelings and allow the client to express them. Telling the client not to worry and saying a cure will be found soon ignore the client's feelings. And starting there, the client seems unhappy. Then attempting to change the subject, identify the client's feelings, but do not follow through by exploring them. And next question. 2 days after undergoing a modified radical mastectomy, a client tells the nurse how I would not be now I would not be sexually attractive to my husband. Based on this statement, which nursing diagnosis is the most appropriate? So anxiety, disturb the body image. Number 3, ineffective sexual pattern. So mastectomy, remove the breast tissue. It is not related to sexual activities. Number 4, ineffective coping. So what are the correct answer? Disturb the body image or ineffective coping? The correct answer say disturb the body image. In this picture, we can see different kind of mastectomy. Remove of the breast tissue, partial, simple, modify radical mastectomy, and radical mastectomies. So why body image? The rationale: A, verbal response to an actual change in physical appearance or structure indicate disturbed body image. A disruption in the way one perceives one's body. The client may be experiencing anxiety, but her statement does not reflect this specifically. And she does not report an accurate difficulties with sexual behavior, which would indicate an ineffective sexuality pattern, not as she expressed an inability to coping or cope. Next question. Family members report exertion and difficulty taking care of a dependent client. The client interests are best served by one, asking the client what he wants. Number two, encouraging family members to discuss the situation among themselves. Number three, telling the family the client should be transferred to a nursing care facility. Number four, calling a family conference and ask the social service for assistance. The correct answer is calling a family conference and asking social services for assistance. The correct answer is meeting with social service can make the client's family aware of the various type of assistance available to them. Family members may not be aware of alternative care measure available. So encouraging family member to discuss the situation among themselves would not address their concern. The client should provide input if he able to do so, but his opinion may not be resolved problem related to the family's exertion and difficulty of providing care. The client may not meet the stringent criteria for admission to the nursing care facilities. Next question. A client friend is visibly disturbed by the client's condition and lack of improvements. He says he feels powerless and unable to help his friends. How should the nurse respond? Number one, agree with the client's friends. Number two, tell the client's friends that there is nothing he can do. Number three, state that she understands how he must feel. Number four, ask the client friends if he like to help with comfort measure. The correct answer is number four, ask the client friends if he does like to help with comfort measure. Rationale said, the client friends expresses a need to help. The nurse should encouraging him to do whatever he feels comfortable doing, such as applying lubricant to the client's lips, placing a moisture cloth on the forehead, or applying lotion to the client's skin. Also agreeing with the client's friends or starting that she understands how the friends feels and does not diminish the friend's sense of powerlessness. And there are many ways the client friends can help if he chooses to do so. What are the next question? A client with acute respiratory distress and watch everything the staff does and demand full explanation for all all procedure and medication. Which action the best indicate that the client has achieved an increased level of psychological comfort. Number one, making decision, decrease eye contact, asking to see family members. Number three, joking jokes about his present condition. And number four, sleeping undisturbed for 3 hours. The correct answer is number four, sleeping undisturbed for 3 hours. The rationale: sleeping undisturbed for a period of time indicate that the client feels more relaxed, comfortable, and trusting, and is less anxious. Decreasing eye contact, asking to see family, and joking may also indicate that the client is more relaxed. However, this also could be diversions. The question: a nurse is caring for a client who has undergone hemicolectomy, means half of the colon is cut and removed because of colon cancer. The woman has 2 children. Which concept about the family should the nurse keep in mind when providing care for this client? Select all type. Number one, illness is one family member can affect all family members. So actually, when I said I am okay, or I'm happy, or I'm fine, it does not mean physically or mentally I am okay only myself. It means I will be happy if myself be happy, if mentally, physically I'm happy, I'm okay. Same time, if the surrounding peoples, they are also good, indirectly or directly, it reflects to my mental and my physical health as well. If someone I love and he or she is sick, I will not feel good too. I will be down. My mood will be collapsed. So illness is one family member can affect all family members. Very true. Number two, family closed do not change because of illness. Number three, a family member may have more than one role at a time in the family. Number four, children typically are not affected by adult illness. Number five, the effect of an illness on a family depends on stage of the family's life cycle. Very true. Number six, change in sleeping and eating pattern may be sign of stress in a family. So what is the correct answer? Number 1, number 3, 5, and 6. Number 1 said, illness is one family member can affect all family members. Number 3, a family member may have more than one role at a time in the family. Number 5, the effect of an illness on a family depends on the stage of the family's life cycle. Number 6, changes in sleeping and eating pattern may be sign of stress in a family. So rationale, illness is one family member can affect all family members, even the children. Each member of a family may have several roles to perform. A middle-aged woman, for example, may have the role of mother or wage earner, wife, and housekeeper. So this middle-aged woman doing housekeeping, she's a wife, she's a mother, she's a money maker as well. So families move through certain predictable life cycle. If she will die, the impact of illness on the family may depend on the stage of life cycle as family members take on different roles and the family structure changes. Illness produces the stress in the family. So if someone is ill in the family, other person will be go for the stress and anxiety. Change in eating and sleeping pattern are the sign of stress. When one family member cannot fulfill a role because of illness, the roles of the other family member are affected. Very, common scenario, and it makes sense. So here we discuss few question and answer. Most of the times we upload our lecture in NCLEX Timeline YouTube channel. We try to motivate our students and give them some confidence before sit for NCLEX board exam. And the question answer we uploaded in NCLEX Timeline, it is very helpful, and it gives you guarantee to pass your board exam. And all of our schedule we made for 2 months. We have a package to finish everything within 2 months. We call 2 months review program. Thank you.